probably started in my early 40s, waking up at 3 o'clock in the morning. I didn't even realize the impact that it was having to my health.
Do you have difficulty falling asleep or staying asleep or getting back to sleep after waking? You're not alone. Today on Health and Family, we learn about the importance of seeking help for our sleep issues for optimal quality of life and well-being.
Broadly speaking, insomnia is defined as difficulty falling asleep, difficulty staying asleep, or waking up and not being able to get back to sleep. It can present in any age group, but there are clusters associated with life events such as school exams in the younger population, job and personal life stressors, hormonal changes associated with menopause, and changes in sleep pattern in the elderly if they are suffering from other illnesses that can interfere with sleep. Sometimes a patient will present complaining of sleep problems, but the majority of patients with insomnia never discuss it with their primary health care provider.
So I'm 55 years old, and my sleep issues probably started 10 or 15 years ago. It wasn't until a year ago when, in the work that I do in the Menopause Chicks community, so many women bring forward the challenges of sleep. And so I've really started to research it, and I found out that insomnia is any time that we have difficulty falling asleep, staying asleep, waking too early, which was me, and when sleep deprivation impacts our quality of life the next day.
Insomnia is much more than feeling tired or poorly after a night of not sleeping well. We know that after a poor night of sleep, we are less productive and may even feel so poorly that we're unable to work the next day.
Well, sleep deprivation and brain fog and raising a small family and running a business and looking after my aging mother. I mean, those are all things that are common to women in this age bracket. I just I think I hit a wall and then kept driving right through it. And I didn't actually realize at the time that sleep was at the root cause of how I was feeling, which was not that great, to be honest.
People experiencing sleep issues often do not seek help from their family doctor. They may not see sleep issues as a serious enough problem, or assume that over-the-counter options are the same as prescription medications.
There are many reasons why some people may not bring sleep disorders to the attention of their primary healthcare provider. Some patients may just consider it a part of life and not recognizing that it is a medical condition that is important to diagnose and properly treat. Some people may feel that it is trivial and they don't want to bother their healthcare provider. They may be self-medicating with over-the-counter remedies or turning to harmful options such as alcohol or other substance use. Overall, the risk of self-treatment can be high because not receiving proper diagnosis by a medical expert and not receiving optimal therapeutic options for treating the condition can cause more harm than good.
In that situation, when you go to talk to your doctor about issues like sleep, it's challenging because you're in that exam room, and next door there's a baby crying, and maybe in the other room there's somebody that cut their arm. Women who are holding up the world, we sit there and it kind of feels shameful to admit, oh, I'm really not sleeping the way I used to. It's a challenging conversation to ask for help.
Sleep issues are an important conversation to have with your doctor, as there are increased options.
There have been significant advances over the last 5 years. We are more aware of the prevalence of insomnia and the health consequences associated with poor sleep. We have recognized the importance of making a proper diagnosis and treating associated conditions that may interfere with sleep. We recognize the value of cognitive behavioral therapy as an important first step in treating insomnia, and we are choosing medications more wisely and better at recognizing the risk versus harm of medication treatment options. We also have newer treatment options that are available that are safer and more specifically designed for treating insomnia with a much lower side effect potential.
Dr. Chow has a final message. Do not suffer in silence.
Do not suffer in silence or adopt ineffective, maladaptive, and possibly harmful self-treatments to manage insomnia. Talk to your healthcare professional to discuss your symptoms and ensure that you are on the best possible treatment available. And this includes a review of good sleep hygiene, cognitive behavioral therapy options, and to have a discussion with your healthcare provider regarding the best possible medication options if medications are required.
Well, there are many things under the umbrella of women's health that I call, back burner health issues, things that we think we should be able to solve on our own. And when it comes to sleep challenges, it might be, oh, I'm just not exercising enough. If I exercise more, maybe I would sleep better at night. Or, maybe I need to get devices out of the bedroom. And all of those things are true. But what I've learned is that maybe when we ask for support for our sleep, that will positively impact our ability to exercise more and to eat better and to focus on those things that take a lot of our energy, our focus, and our concentration. So now I'm a huge advocate for sleep being on the front burner and for asking for support no matter what.
To learn more, speak with your doctor or visit the website below, help2sleep.ca.